Welcome to the Patient Assessment Trauma Skill Station. In this skill, you will have 10 minutes to perform your assessment and voice treat all conditions and injuries that you find. Just as you would in the field, conduct this assessment communicating with the simulated patient. If you need to, you may remove the patient's clothing down to their shorts so that you can better assess them. Specific clinical information not obtained through visual or physical inspection, for example, blood pressure, will be given to you only when you ask, following a demonstration of how you would obtain the information in the field. You will have 2 partners available to assist you that are trained to the same level of care that you are. They will correctly perform the verbal treatments that you ask for. I will acknowledge your treatments and may ask for additional clarification if needed. Do you have any questions?
I do not.
You respond to a report of a high-speed T-bone collision between 2 mid-sized cars. Your patient is a 28-year-old female who was removed by bystanders prior to your arrival. She is lying on the pavement when you arrive.
BSIP, my scene is safe. Mechanism of injury is a motor vehicle accident. Number of patients I have here is 1 patient. I'm going to go ahead and request for more EMS help, and I can cancel if needed. Due to the mechanism of injury and a motor vehicle accident, I'm going to put this patient in C-spine precautions, and I'll have one of my partners hold a manual inline stabilization of the head and neck. My general impression of this patient is a motor vehicle accident with possible multi-system trauma. The level of consciousness, ma'am, can you hear me? Okay, so response to pain. And so chief complaint would be possible multi-system trauma. I'm going to go down ABCs. So airway, I'm going to look, listen, feel. Do I see any secretions or obstructions in her airway?
No secretions, her airway is open.
All right, so her airway is patent. Breathing, I'm going to visually look at the chest rise and fall, but I'm also going to listen for breath sounds.
The patient is breathing at 24 times per minute and it is shallow.
Okay, and I'm going to go ahead and place an oral adjunct, and can I also get an SpO2?
The SpO2 is 92%.
Okay, and place her on with a non-rebreather with high flow oxygen. Circulation, I want to go ahead and check for radial pulses.
Her pulse is 112 beats per minute.
And skin.
Her skin is pale and cool.
Okay. Due to her breathing, the mechanism of injury, and the mechanism of this accident, I'm going to request this is a priority transport. I want to get a full set of vital signs. I would assign one of my partners to get a blood pressure, breaths per minute, get a pulse again, and also get SpO2.
The blood pressure is 92/64. Her pulse is 112 beats per minute. She is satting at 94% with the oxygen that you're administering, and her respiratory rate is 22 breaths per minute.
Okay. Due to her level of consciousness, I cannot obtain a sample history. So at this time, I am going to go ahead and run through a head to toe. While doing that head to toe, I'll also expose my patient and check for any possible injuries. So I'm going to start here, the forehead, checking the skull, check around the back of the head. Do I feel anything or see any abnormalities?
No, you know no abnormalities.
Okay, I'm going to also check around cheekbones, eye sockets, and check the eyes, check the pupils for responsiveness.
Pupils are equal and reactive. You note venous bleeding to her right cheek.
Okay. Checking the ears for any secretions.
No secretion.
Okay. I'm going to reach behind and feel her cervical spine.
No deformities noted.
Okay. Just checking the neck. Do I see any jugular vein distension?
No jugular vein distension, and your trachea is midline.
Okay. Checking her down, feeling her shoulders. I'm going to palpate her chest.
Is normal.
Okay.
No crepitus.
No crepitus. I don't. And Her breathing is bilateral, chest rise and fall.
Yes.
Okay. I'm going to palpate her abdomen.
Her abdomen is soft. No traumas noted.
Okay. And with her pelvis.
Pelvis is stable.
I'm going to go down each individual leg and palpate each leg, checking for blood as I go along, and crepitus, any abnormalities.
Nothing noted on the right side.
Okay, as I get down, I'm going to check fetal pulses.
You have fetal pulses present in both legs.
Okay, I'm going to work myself up. As I go up, I'm going to expose the leg, and I'm going to check again for any blood, any crepitus, anything.
You note swelling on her left femur,
Okay,
and the leg is short.
okay. Is there any rotation?
There's no rotation present.
Okay, and it's midline?
That is correct.
Okay, due to the nature of that, I have a possible femur fracture, and since there is no crepitus in her pelvis, that we can move along with a traction splint, long bone, for a long bone injury. So I'd have one of my partners go ahead and place a traction splint on the patient. I'm going to go ahead and come back up to the arms, check those really quick.
Right arm is normal.
Okay. Checking.
And the left arm is normal.
All right. So I want to go ahead and come back, manage any of the secondary injuries. I want to reevaluate the traction splint. I want to bandage up those venous bleeding that was on her head, and just basically monitor vital signs. And I want to get my patient ready for transport. So I'll go ahead and place her on a backboard. And I need to evaluate the spine as well when we do that. So we're going to go ahead and roll her towards myself. Feeling her spine. Do I feel any crepitus, any deformities?
No crepitus, no deformities.
Okay, so we'll slide over, and on heads count.
1, 2, 3. 1, 2, 3.
And so got her on the backboard. We want to reassess CMS once we get her